This is going to talk about the individual parts of the nervous system where we look at the brain itself. And so let's start with the central nervous system. There's three basic functions. It receives the sensory input, performs integration. Remember, that is deciding what to respond to and what not to respond to. And it generates a motor output. So it takes in the information, decides what to respond to, and then sends the message out and tells the body what to do. Interestingly, the spinal cord can actually make decisions before it gets to the brain itself, and we'll talk about that in just a minute. It's called a reflex. Let's take a look at the spinal cord itself. There are three protective membranes that wrap around the spinal cord in the brain, and these are called meninges. And you might have heard of meningitis. That's an inflammation or infection of the meninges. The spaces between the meninges are filled with the cerebral spinal fluid, and that's going to circulate through the ventricles in the brain as well as the spinal cord. Remember, it's hollow. It's a tubular nerve cord. It's not solid. The fluid, as I mentioned, is found in the central canal of the spinal cord and the ventricles of the brain. One of its job is to cushion and protect it. So as we mentioned, it lubricates it, but it also acts as a cushion absorbing damage. We know head injuries today. Your body can't absorb as much injury as we do to it, especially in sports like football and some of the others like baseball where they get hit in the head occasionally. But the body can only protect it so much, and after that it's even worse. Shaken baby syndrome is awful. The baby's brains are so soft. It's like jello that hasn't really set up yet. It's so soft that shaking it can actually cause parts of the brain to disengage from the rest of the brain, and the child can have serious lifelong injuries. And as I mentioned, there are meningitis. This can be bacterial or viral. I got viral meningitis when I was in college. No, it was bacterial. When I was in college in an RA, we had gone to a camp, and I evidently got bit by a mosquito and ended up in the hospital for 4 or 5 days. And after a couple of spinal taps, they finally let me go home. But it's not anything to mess around with. The spinal cord, two main functions. It's a center for reflex action. That's what we were talking about there. Your spinal cord has the ability to decide exactly what's going on. If you put your hand on a hot stove, the spinal cord's like, ah, crap, the idiot put their hand on the stove again. So it allows your muscles to pull the hand away before you even know that you've done it. That's a reflex action. Same thing if you're playing sports. Those of you that are athletic, the more you developed in practice, the better your reflex actions are. If you see that ball coming towards you, you can either duck or put your hand up to catch it. The better you are at that, obviously the better you are at your sport, but that's what we call a reflex. The spinal cord is also the connection between the brain and the body, the spinal nerves. We mentioned it has the gray matter and the white matter. Gray matter is the cell bodies and the unmyelinated fibers. Remember, it doesn't have the coating on it. Whereas the white matter is the myelinated fibers, and that's what gives it its color. The white matter tracks connect the spinal cord and the brain. So the gray matter is kind of around it, but the white matter is what really brings it up to the brain itself. If we're looking at the parts of the brain, the largest portion of your brain is called the cerebrum. We know that it's broken into the different lobes. If you've taken psychology, you've seen this. The frontal lobe's at the front. The parietal is at kind of at the, if you put your hand on top of on your forehead and walk your fingers back, the parietal is the part that's at the top on the back. The temporal's at your sides, at your temples above your ears. You can rub those, when you get a headache. And then the occipital is towards the bottom. This is the part that when you whack it, you see stars. A lot of what the occipital is concerned with is, of course, sight. If we go back to the cerebrum itself, we have the right and the left cerebral hemispheres. I was reading an article last night about a woman that didn't have a right cerebral hemisphere. And so she could read and she could sort of function, but if you said one word, she would interpret it as a different word. And I'm thinking, oh my gosh, how awful would that be to live that way, not being able to really communicate well. What connects the two cerebral hemispheres is the corpus callosum. In the early, I don't remember what year, 20s and 30s, I think it was, they did lobotomies where they would go in, if people had seizures or some kind of psychiatric disorder, they would go in and try to cut this corpus callosum, because the idea is if you separate the two halves of the brain, then they can function independently instead of like fighting. And most of those people ended up as vegetables. One of the members of the Kennedy family, I think it was Rose, that they did, and she was in an institution the rest of her life. because it didn't work. For most people, it did not actually work at all. But that's what they do in a lobotomy, is they cut the corpus callosum. And then the grooves divide the hemisphere into the two paired lobes. And here you can see the different fissures and markings on the brain itself. The cerebrum up here is at the top. The blue and the darker blue colors you can see are the meninges with the fluid. And then we have the skull that's enclosing it. This is the frontal lobe. This part right here is the parietal. This is the occipital. And the temporal you can't see because of the way this brain is laying there. But these are the different parts that we'll be talking about in just a minute as well. On the outside, you can see better the lobes of the brain. You have your motor, your speech areas, your prefrontal area, the temporal. This is sound, which makes sense because it's on the side where the ears are at, as well as speech. So there's a couple of speech areas. So when someone has a stroke, they may lose some speech, but have other speech because of the damage that was done. The parietal lobe, this is your taste, touch. This is your sensation area. And then the occipital lobe is visual. And then down here, of course, is the cerebellum. And it's not one of the lobes of the cerebrum, but one of its function is balance. So the cerebral cortex, we mentioned, has the outer gray matter. The white matter's towards the center. It includes the motor and the sensory areas, and we just talked about those, so I'm not going to spend much time on these. The basal nuclei can integrate motor commands. This is where it's like little command centers in your brain that the information comes in and they say, okay, take care of this, ignore that. Take care of this, ignore that. We talked about Parkinson's here. It's a brain disorder by tremor, speech difficulty, and the result from a loss of dopamine producing cells. So some of those drugs that people are doing destroy the cells in this area, and that causes Parkinson's to happen. If you're a Grey's Anatomy fan, you remember an episode where they did surgery on a guy so he could walk his daughter down the aisle, and at one point they hit a part of the brain that he couldn't respond, and they were able to fix it, of course, and go back into other areas and fix his Parkinson's. It's pretty risky, and they do keep you awake. I can't imagine being awake during that surgery. There was another one that they did the little boy with the spelling bee. A lot of those cases in Grey's Anatomy are based on true cases, but not all of them are in there. But Parkinson's is a devastating disease. The workshop I went to on this, the presenter said that she doesn't mind that all these young people are getting Parkinson's, because she said they're doing more research on younger people, so by the time she gets it, they'll have better treatments. And that's kind of a sad way to look at it, but it's true. The use of a lot of these drugs today is causing an increase in Parkinson's. Other parts of the brain, the diencephalon, this is the area around the third ventricle, and it includes the hypothalamus. We mentioned this is your homeostasis area. If you've seen, what's the name of it? Osmosis Jones, that's the hypothalamus. They go and I think they steal the DNA out of it, but that controls your homeostasis. This is the regulating of all of your body systems, your thirst center, your heart rate, blood pressure, all of that. And then it goes directly to the medulla to tell it what to do. And then the pituitary gland is under the control of the hypothalamus as well. The thalamus, it's a mass of gray matter located in the sides and the roof of the third ventricle. It receives all sensory information except for smell. Kind of interesting that smell's not part of that. But the sensory information comes in, and then it goes to the different areas of the cerebrum, especially the parietal lobe, because that is going to sort out that information. The pineal gland is pretty important. This is the reason why you want to power down about an hour before bedtime, get off of any kind of screens, especially the ones that emit blue light, because it can affect the pineal gland, and that keeps us from getting our normal sleep-wake cycle going. Any lights that you have in your room, like as you plug stuff in, cover them with black tape so that those lights are actually affecting you while you sleep as well. As dark as you can make it in your room, the better it's going to be, because the more melatonin that will be secreted. And then the cerebellum, my cerebellum sucks. Most of you probably have a better cerebellum than I do, because I'm not very coordinated. People that are athletes and dancers, they have an extremely well-developed cerebellum. The rest of us, not so great. But this gets information from the eyes, the ears, the joints, and the muscles, and it sends motor impulses. Remember, motor is muscle. Motor is muscle, and it will cause a movement to the skeletal muscles, and that's why the cerebellum is so well developed in athletes and dancers. The midbrain and pons, the medulla oblongata, these are all part of the brainstem. The midbrain is a relay station. It's tracks that pass between the cerebrum and the spinal cord or cerebellum, and so the information comes in and it sends it where it needs to go. The pons is a bridge that's formed between the cerebellum and the rest of the nervous system. It kind of has its own little depot distribution center because it's your skeletal movements. It's one of its major functions is your movement. And then the medulla oblongata, this is our reflex center. We mentioned that the hypothalamus tells the medulla what to do to maintain it, but this is vomiting, coughing, sneezing, hiccuping, swallowing, heartbeat, respiration, all of that stuff is found in the medulla oblongata. So it's pretty important. It's pretty hard to damage it. You can damage it, but it's pretty hard to do it because it's tucked so far up into the brain itself. Now there's a system called the RAS system, reticular activating system. This is a network of nuclei and nerve fibers, and this is the part that arouses the cerebrum by way of the thalamus and causes us to be alert. When your RAS shuts down due to alcohol use or drug use or whatever, it slows down the RAS system and it causes the person to be a lot less alert. Here you can see how it functions from the spinal cord up through the brain, and then the effects into the cerebral cortex. The limbic system. Your limbic system, I know on Big Bang Theory, they bring this one up every once in a while because it's higher mental functions and your primitive emotions. A lot of, sexual impulse, a lot of things like that is controlled within this part of the system. It's also the parts that are extinguished in Alzheimer's. This is the part of the brain that goes dim and no longer functions in Alzheimer's patients, and they're trying to figure out why, but it is the part that they're studying to see what's going on in the brain. The hippocampus is kind of a seahorse shape right here. See that there? It wraps right around the third ventricle there, and then the amygdala or amygdalia, however you want to say it, amygdala is this part right here. And these two are responsible for memory as well as recalling past experiences. So the ability to hold a thought in your mind is, of course, memory, and learning is when we retain and use the memories. It's not just remembering, it's using those memories that are there. The short-term memory is the prefrontal area. The long-term is associated with the hippocampus. So people in Alzheimer's, the hippocampus is the part that is getting destroyed, no longer functioning, and so they can remember, I'm sorry, it's not the hippocampus, it's the amygdala. They don't have short-term memory, but they have long-term memory, and the long-term memory is what's stored in the hippocampus. They might remember easily what they did as a child, but don't remember what they had for lunch, and that's the situation with my mom. She can remember some things back for a while, but if you ask her what she just ate, she has no idea, and she's not able to communicate that information as easily. The somatic system includes the cranial and spinal nerves, and this is going to bring information in from the senses, and it controls the skeletal muscles. It's voluntary. You consciously think of this system. Autonomic means automatic. It happens, we don't think about it. Yes, you can make yourself throw up. Yes, you can slow your heart down and all that. But generally, the autonomic is usually involuntary. That's why it says usually there. And we mentioned it's divided into the sympathetic and the parasympathetic. So here you can see the lower part where you've got the nerves that are coming into the brainstem itself, and then you've got your optic chiasm here, which is where the eyes cross over, so the right eye actually controls the left side of the brain and vice versa. And then you can see your olfactory bulbs underneath the brain itself, sending information from your smell into the brain itself. And here's where the spinal cord's coming in. The medulla, there's the cerebellum. And here you can see the cross-section of a true spinal cord here. The outside is the white matter, the inside is the gray matter, and it kind of switches in the brain. But this white matter is what connects to the brain to the spinal cord. And you can see the fat in around the spinal cord cushioning it from the vertebrae, and then in between two vertebrae are going to actually be discs, and we'll see that later when we talk about the skeletal system. Okay, So we talked about how information comes in by way of the sensory, it goes to the interneurons, and then it comes back out through the motor neurons. Well, in a reflex arc, you may actually react before you realize what's happening. So let's see how this happens here. Here a pin, you've stepped on a pin or you poked yourself with a pin. Information comes in by way of the sensory, goes to the spinal cord, and the spinal cord's like, crap, we don't have time to think about this. Just pull the pin out. So it sends a message directly back out to the muscle that causes you to either pull your hand away or pull the pin out before you even realize you're in pain. You know how you get that delayed few second reaction? That's because this reflex pathway is so fast, and it has to be in order for us to survive. And so this is what we see happening in the reflex pathway, is the spinal cord made the decision not to let the brain decide what to do. It made the decision to move the hand away quickly, and at the same time though, it does send the message to the brain, so the brain's aware of what's happening, but you've moved before you realize it's happened. And so that's what we know of as a reflex arc. Here you can see the pathway. It comes in from the oh, they don't have it on here. Okay, it's coming in from the sensory neurons through the central nervous system right back out through the motor neuron, and there it tells the body what to do. So it could be a gland, it could be a muscle, some kind of a instant reflex is going to happen here in the body. As we mentioned earlier, there's two divisions of the peripheral nervous system. We have the sympathetic and the parasympathetic. If someone is in stress, you feel sympathy, and that's how to remember that one. It's the fight or flight. It's going to accelerate your heart rate, dilate your bronchi so you can get more oxygen in, activate the muscles. That's where you start getting jittery and have to move around because you're being flooded with glucose and oxygen. And all of that is part of your sympathetic system. Adrenaline plays a big role in this. That's a hormone that's a neurotransmitter for the sympathetic system. Parasympathetic, though, is what you really want working most of the time. Just take a second right now. Are your shoulders relaxed? Are you relaxed? Are you focused on what you're doing? Just take a minute and let the parasympathetic take over as opposed to the sympathetic. Your sympathetic's going, is she going to get done? Are we finished with this? Let's move on. You know, it's not giving you time to relax and learn the information that's there. But your parasympathetic is your housekeeper system. It's all in a relaxed state, all the internal responses. I read an article on meditation this week that said that men and women that meditate, their brain is about 7.5 years younger than people that don't because of all the plaque that builds up on the brain. And so meditation allows the parasympathetic to take over and cause you to just generally kick back and relax and promote digestion. It slows down your heart rate, whereas the sympathetic keeps that food in your stomach longer. You know, when you're stressed out and you might throw up 7-8 hours later and all the food's still there, that's because your digestive system shut down because your sympathetic was engaged. So just being aware of which system is engaged will help you function better. Here you can see the comparison between the two. We have the dilation as opposed to the constriction, and then all of the different activities. And there's a good picture of this in your book because the text isn't good on here. But the sympathetic and the parasympathetic are the two divisions that we see in the brain and the spinal cord. If we compare the different types ones, you can see, I'm not going to go over those again. We've already talked about all those. You have your neurotransmitters and what kind of effect that they're going to have on which part of the body. And as always, I'm in love with Heart and Brain comic strip, and they have a new game out if you haven't seen it yet. It's called Heart Attack. I played it with my family this week. It is hysterical. You can get it on their website, Awkward Yeti. It's about $25, but they just got it out of the Kickstarter campaign, and it is well worth it. If you're looking for an unusual gift for somebody, it's a great gift. And we had a lot of fun playing it this week. I hope you have a wonderful week and do well on the test.